If you are having blood work done or your clients are having blood work done, we always suggest following basic guidelines. One of those being to try not to weight train for 24 hours prior. Now, I do get some pushback on this, but I'm going to tell you why it does matter. So we want to be really thoughtful of getting the best possible picture of what we want to see and not having any flags of dramatic concern, right? So a client sent me her most recent lab work and by her provider, and I noticed some areas were just pretty skewed from what I'm used to seeing for her, just very abnormal for her. Not saying people can't change, we see it all the time. So I pointed out these areas. I said, let me know what your provider makes of this. And then I also went into a little bit of a discussion on some things that can affect it. One of those was weight training. And so it turns out for this client, I was seeing skewed markers with regards to AST, ALT, BUN, creatinine, and a lower EGFR. Well, if you have weight trained prior to your lab work, she weight trained 2 hours prior to her lab work, we could see these markers skewed. So why could that be? So AST, ALT are not exclusively liver markers. We also find them in muscle tissue, and when we are strength training, weight training, we can cause perhaps just a transient increase in these due to muscle breakdown and repair. Same thing with creatinine. It's a byproduct of muscle metabolism. So here again, weight training can increase that release, to which EGFR estimated based off that creatinine level. So if creatinine is artificially elevated due to weight training, we may see that that is falsely low. We can also see some changes in BUN, which is something that a lot of people see, even with just dehydration, even mild dehydration post-training can affect that. So some basic guidelines that I would suggest is always making sure that you try best possible scenario to not weight train 24 hours prior. Also make sure you are well hydrated. And if you do weight train, make sure you communicate that to your provider. And perhaps they might just want to just rerun that CBC and that CMP panel one more time.